Good afternoon, everyone. Good afternoon, Dr. Andrade, Mr. Fisk, Ms. Johnson, and everyone else. This is the August Board of Health meeting. Today is Thursday, August 1st at 4:37. We open up officially the meeting, and I will pass over to Chairperson Dr. Andrade, but let me also mention that this meeting is being recorded for the record.
Thank you, Dr. Mansour. Welcome, everyone. Welcome, Mr. Fisk, Ms. Johnson, and Mr. Doucette. Our first agenda item is to approve the minutes from June 6th, 2024. Do I have a motion to approve those minutes?
I have a motion here to approve the minutes as read.
Seconded, and we have approved those minutes.
Right.
Mr. Chair, there is a little typo in the spelling of first name of Ms. Johnson. So, in other words, the transcription went on with a typo in it, but just for the record, to make sure that we are aware that there was a typo in her first name in the spelling.
We will never do that again. Thank you for highlighting that, and so record shows that we have a typo, and we will correct that for future reference. Thank you. Other than that, anything else that people, well, I think we can go ahead and know that the minutes have been approved and move forward with the hearing of several meetings regarding violations of tobacco permits. Mr. Doucette, you have, am I saying that correctly? Is it Doucette or Duquette?
Yes, sir. Yep, that's correct. Doucette.
Doucette, thank you. You have the floor, sir.
Okay, very well. Thank you, Mr. Chair. Yes, we have a few matters on for this evening. All of them are very standard violations that we've been encountering. To begin with, in order as they appear on the agenda, the matter of Two Debbie's convenience store located at 516 Pleasant Street. During a routine inspection on the 14th of June, flavored tobacco products were observed offered for sales. A check of our state database indicates to us that this is the second such violation for this establishment within a 36-month period of time. Therefore, a $2,000 fine was assessed, that fine being in accordance with the state CMR 105665, that calls for a second violation to incur a $2,000 monetary citation. Also, because it is a second violation, the store is subject to a period of suspension from tobacco sales. That our pattern of enforcement and indeed the decisions of this board warrant that because it's a second violation, that they shall receive a 7-day suspension of their tobacco sales.
Is there anyone from this outlet that is looking to have any comments here for today?
Yeah.
Go ahead, Doctor, please.
Yeah, for the record, this morning I received a call from Attorney Nasrallah. Obviously, he has been retained to appeal before the board. However, he said he didn't have enough time to prepare and request a hearing, that the hearing be postponed till September. And they sent me also an email to that effect.
And is there any concern about that with you, Mr. Doucette?
No, I think that's in line with due process. If he made contact with us today, I think it should be allowed. Okay.
Thank you. So let the record show that we will readdress this at the next September meeting. The second, we have a guest, Sarah McColgan. Who is she? Who are you representing, ma'am?
Good evening.
I see you.
I'm with the Massachusetts Health Officers Association.
Of course you are. Thank you for reintroducing yourself. Sorry for that confusion.
Oh, that's okay. Off camera, you never know who you're talking to, do you?
And Ms. Uria? just for the record, you are representing,
Hi, the Brockton Board of Health is a community health worker.
got it, just to be sure. So our next violation is with the country food store.
That is correct, sir. During a routine inspection on the 4th of June, flavored tobacco products were observed offered for sales. Similarly to the previous agenda item, this is the second violation for this establishment within 36 months. A $2,000 monetary citation has been assigned. As it is the second violation, they are subject to a period of suspension. And for second violations, this board has been assigning periods of suspension in the amount of 7 days.
So again, just to be sure, is there anyone here to represent this institution? Seeing none, we will move forward. Is there a motion to move on the suspension and the fine as discussed by Mr. Doucette?
I make a motion that we, go along with what Mr. Doucette says and what is the state findings that we have to go by.
I second that motion, and that passes, and you can move forward with that, Mr. Doucette.
Very well, sir.
We have a third violation with R&K Food Mart.
Correct. Yes, sir. During a routine inspection on the 25th of June, tobacco products not in their original manufacturer's packaging were observed offered for sale. That this would be the first violation for this establishment within a 36-month period of time. A $1,000 fine was assessed. This violation does not call for a period of suspension. However, the proprietor of this establishment asked for a hearing in writing in front of this board. For that fact, he was notified and placed on the agenda. However, even though I have spoken to him recently in regards to this, I do not see him present today at this hearing.
So can you, for the listeners, just say what the concern is about having a product of tobacco outside of its packaging?
Certainly, sir. Yes. The state CMR, which is 105 CMR 665.030, talks about out-of-package tobacco sales. And a few things are involved in that. That the language that they speak of talks about tobacco in any form other than any original package, factory wrapped package is prohibited, including the repackaging or dispensing of any tobacco product for retail sale. And indeed, in this instance, that is exactly what we have observed. We observed packages of powdered tobacco, commonly known as snuff, that were packaged in aluminum foil, and the origin is unknown.
So there's all kinds of different elements with that. So people could, an outlet could, for example, break up a package and sell individual portions of that for a different price and ultimately likely make more money otherwise, or somehow discount this for individuals, and all kinds of different permutations of that.
Correct, yes, sir. Also, the product could be altered aside from its original chemical makeup, and for safety's sake,
Right.
along with those other factors that you mentioned.
Right. So do I have a motion to move forward with the recommended fine for this outlet?
I make a motion that we proceed with the fine.
Second that motion, and we'll move forward to the fourth. Getting ready to sing Motown songs. Garcia Tobacco Grocery.
Yep, correct, sir. Also, during a routine inspection on the 3rd of June, tobacco products not in their original manufacturer's packaging were observed offered for sale. That this will be a first violation for this establishment within a 36-month period of time. A $1,000 fine was assessed. we received communication from a law firm, Ken Goldberg, that he represented the proprietors of the establishment and that they request a hearing. However, since that time, they have paid the monetary citation and they sent communication to me to indicate that they no longer had a need to have a hearing.
So they've already paid the fine, and ultimately we can just make a motion to be sure that we have recognized this, and could we have a motion just to approve that fine and acknowledge that the Board of Health has been apprised of the circumstances?
Yeah, I make a motion that, we put it into the record in case it does happen again.
Thank you. So second that motion, that's so moved. Can you say anything, Mr. Doucette, about the seemingly kind of ongoing frequency of these violations? I haven't, since my time, I don't know about you, Mr. Fisk, being on the board, I haven't heard of the breaking up of packages and selling that since I've been here. And it seems like there's a frequency that's building in terms of the violations.
It's a common
Yeah.
practice. It's a common
Yes, sir.
practice. I
No,
see
I
it
know it's
all
a
the
common
time.
practice, but I haven't heard it here. It's and
No,
presented.
I
to the
think
board.
that's the first time I have
Yeah.
too. But I mean,
Yeah,
it's never
so
come to us, but I know it's a common practice.
Yes, sir. We do observe a pattern that, in particular, this product of the powdered tobacco, the snuff, I am told that it is popular in certain ethnic populations here within our community, and that we observe it in the instances that we have observed it. It has been wrapped in aluminum foil, which would lead me to believe that it's coming from the same source, although
Yeah.
I have not been able to isolate what that source is.
That's
And
a
otherwise-
Cape Verdean product that a lot of people have, they put it in little containers around their neck and things like that. I know exactly what.
As a nurse, I remember patients in the hospital seeing that as the same. And the selling of Lucy's, as they would call it in New York, is not uncommon either. So is there anything that we can do about this concern other than the fines and that raises the warning?
I mean, potentially I could form liaison with the police. Indeed, I already have it to a great depth to investigate the proprietors of these establishments, to question them about where they are procuring it.
Yeah, I think the particular concern is if there are any tainted products that could cause harm and damage to individuals, that would be something that we want to prevent if possible.
I agree. In observing this product, that is also my primary concern.
Sarah, you want to offer any comments?
I don't think so, Dr. Andrade. I think that Mr. Doucette is on the right path as far as doing the enforcement. A lot of times something like that in a little small foil wrapper is not going to be easy to detect. But as I've told Mr. Doucette before, he's got eagle eyes and he's like a pit bull going in there doing the enforcement. So I think given enough time that he'll be able to successfully put a damper on some of this within Brockton.
This could be a reality show for you, Mr. Doucette. You could be tobacco control, like a CSI kind of TV show.
Hopefully in my younger days, something similar to like 21 Jump Street.
Tanika, do you want to say something?
Yes, I did want to just make sure, just to call to attention to a comment that Mr. Fisk raised in terms of having these tobacco, the tobacco within the foil be a potential ancestral offering. And so I think that it's something that we should have, it's worthwhile maybe having a conversation, or whether it's the police who's going to do an investigation, just to kind of clarify that. Not to say that it should be accepted, however, we should be compassionate to different cultural practices and maybe even brainstorm with the proprietors ways in which they can do that lawfully.
Another consideration that could be something to, and I wonder, Sarah, if there other cities and towns that are dealing with this and have discovered any promising practices?
I'm sure that there are, but I've never heard of anything, as far as a best practice in how to deal with it lawfully. I know, tobacco is a concern, in the indigenous population, and because they use it for various ceremonies and things like that. I don't know a lot about this, how this product is being used. So it could be a similar situation,
Yeah.
but I'm not sure how you would determine if that's what's going on as opposed to kind of in a ceremonial situation.
Right, and your quality control and all those other kinds of things are
Right.
issues
That
to
is a
be
big concern.
in mind.
Yes.
Well, given those four, well, is the Olympic market the final one?
So I have received additional written and verbal communication from the proprietor of Olympic Market. This violation took place in May. It was a routine inspection in which we observed loose cigarettes, flavored, offered for sale. $1,000 fine was assessed. The proprietor of that establishment requested a hearing. That hearing took place in April. The proprietor was not able to attend. He claimed that he had technical difficulty, and I believe he had a conversation with Dr. Mondesir in regards to that. He was then subsequently placed on the agenda for today, after sending written communication to me to indicate that he would like to have an attempt at a hearing. And however, I spoke to him as late as last week in regards to it. Again, he is not present today.
So again, we can't assume anything, but we have to move forward, I would suggest. Is that, do you concur with that?
It exists on the record that during the hearing of April, as the proprietor was not present, we enforced the monetary citation.
So has he paid the fine?
He has not yet, but he has had communication on file to indicate that he wanted to have a hearing throughout the interim of July when the meeting was postponed.
So do you have recommendations?
We should uphold the $1,000 monetary citation. No period of suspension is necessary at this time, as it was the first violation for this establishment within 36 months.
Do I have a motion to enforce that fine?
I make a
for the
motion that
Olympic
we
market?
enforce it. It's just too bad he's not here,
I second that motion and let the record show that will be, we'll be mailing the notice of the fine and the requirement to pay.
Correct, yes, sir.
Great. Anything else that you have to bring forward, Mr. Doucette?
That's all we have for this month, sir, due to periods of notification that are statutory in the CMR. We weren't able to get all of the violations onto this month's agenda, so I guarantee you we'll see you next month.
All right. Thank you for your service, sir. Have a great evening.
Thank you, you as well, and all others present.
Take care now.
Good evening.
Thank you. Take care.
Thank you.
So, we have item number 4, the latest statistics around COVID cases.
Yes, thank you. I did put the latest statistics there as was published by the health department here. And this morning also we counted 13 new cases in double digit as has been lately, and the total active cases is 88. And we started July with 545 deaths, but one has been assessed, and the pathology was of one was removed, so that we moved from 545 deaths to 544. So that leaves us with a total of 35,490 cases being reported. Now, again, for Ms. Johnson, who may be new with us, the total cumulative number of cases doesn't necessarily mean those are 35,490 individuals. We don't have a pattern to use to know the how many people have been reinfected, but that's how it is. Those numbers are given from DPH, and then we report them on a daily basis. So the best we can do with it is it reflects the total number of cumulative COVID cases that have been reported through DPH from the beginning of the pandemic to date. We must also mention that since home test kits have been implemented, that's a whole set of other positive cases that we do not capture in the data here.
Well, therein lies a repeat of the same consideration, Dr. Montessori, the idea that we would continue to put these items on our agenda, given the variance of what we know and what we don't know. The idea that we have reported cases and ideally hospitalized cases would be of interest, but other than that, those that are doing home tests and managing their infection and moving through hopefully relatively smoothly. Again, the question of whether it is a good use of the board's time to continue to discuss this as a consideration. We can talk about that offline, but again, I think to a degree it's less relevant than it used to be.
I agree. One aspect of reporting, I think we still have it. It gives us a closer look at the epidemic or the endemic phase of COVID. That is the biobat or the wastewater, because DPH still pays for it, contracts with biobat to do it, and we have it. It comes out weekly, and so it usually shows the level of concentration of the virus in the community.
Yeah, and unless there is a concentration that is relevant for the Brockton area, or that it becomes at a level that is of concern, that's something that we could, as you create the agenda, have discussion about and raise it if necessary and useful or not. So again, we can talk about that offline, and just saying all this out loud in the midst of our listeners, including those here on the call. It is it's a point of interest, and its relevance is slowly waning.
Yes, although in recent weeks, we've seen the double-digit stay at that level, from 10 to 18 or so, and then goes down to low teens, but it remains double digits. So it is a little bit of a concern for us, but
but it's a concern like the flu is a concern.
Yeah.
And we're not reporting the flu, right? People before COVID, people were dying from the flu.
Yes,
and so again, a minor concern, but a concern in the scope of it being framed around a flu-like illness.
Yes, I concur.
So with that said, I'd suggest we kind of, if you have anything outlying that you want to raise in item 5 or 6, we could, or we could skip to item 7 with vaccinations.
Yes, we could jump to 7. Vaccination, we continue to do that. We do it at the Shaw Center. We continue to do that on a specific day of the week, which is Tuesday, 1 to 4. And we also provide sporadic vaccination during the wellness clinics that we do here and there, sometimes at the farmers market around City Hall, sometime at the FC, which is one of the newest organizations that we've been supporting, as well as another organization that cares for adults, which we call Adult Day Care Center. So those are the areas where we provide the COVID vaccination, and so far that's what we have been doing in terms of vaccination. That's about it for COVID.
So I have from agenda item 7, and then it goes to 9. Is 9 8?
Yes, I have removed the inadvertently I have skipped number 8 there with the viral load. So that would have been the viral load,
Okay.
which we spoke of already. So
So
that can,
item 9.
yeah, we can talk about TB. Basically, we have an ongoing intervention with TB cases with the nurses, the public health nurses, as well as the community health workers. And one of whom is with us tonight, as she has the last time, Miss Urea. We have seen some of the TB patients complete their treatment, which is wonderful because so far we can say that the department has received high praise. The nurses and the community health workers have followed those cases, most of them all the way through until completion of treatment. I said most of them because I think we have maybe 1 or 2 cases that have moved out of the jurisdiction, and so we were not able to follow with them. However, in spite of the progress made with those cases that have completed treatment successfully, we keep on receiving new cases. So it's like automatically we finish when we have a case or 2 that complete treatment, then we have 1 or 2 more cases. So it's like the incidence remains at the same level, but thankfully we will continue to do this. One thing that DPH has allowed us to do also is to provide through the grant to provide transportation for those patients so that they do not miss their medical appointments.
Great.
Good.
Ms. Marie, you want to offer any other feedback? Mr. Uria? No? Okay. Any other questions? Moving on to item 10, health promotion and public health education.
Yes, we have been pushing this, and the health, the wellness, the community health clinics with the wellness team that involves the nurses and the community health workers. They work together, and they're also looking forward to add a component, and that is to do nutrition, education around nutrition, to educate the people, because some of them, when they do the clinics, the nurses also do diabetes, check for diabetes, and they find that it is a good way to help to interact with the community, with the residents, to educate them around nutrition as a way to address diabetes.
Any questions?
Nothing here.
Moving on to item 11, the National Mental Health Emergency Hotline.
I'll say a word on this. Well, the number is still active, 988, but I will also add a word here. I think this is the first time I have the opportunity to say a few words around the community health assessment that we have launched. The new epidemiologist that we have, who is a trained physician as well, but we work with him just as just as an medical epidemiologist. So he completed the survey and tabulated the data, and we found out that mental health tops the issues around the city. So this is a concern with the department, and I'm trying to address it because I did not realize how severe it was or how widespread it was. I mean, I do know that we have mental health, but not to that level, to that extent. So it's more widespread than I probably want to accept.
Well, and I think the good news is that people are feeling more comfortable stepping forward and saying that out loud. The stigma seems to be diminished, at least in some subpopulations. Young people in particular seem more readily willing to raise their hand and say that they need help, which is good news. And we're still trying to catch up for resources to be able to kind of fill the need in a way that is impactful. This is this is an issue in Brockton. It's an issue in Massachusetts, as it is across the country. Anything you want to add, Genesia? Just no. So item number
Miscellaneous 12 and 11, 12 and miscellaneous. There are a few things maybe I could highlight there, but also let me mention that HIV is also a concern because I realize that COVID has dropped, but everything else seems to be coming to the spotlight. When I do a due diligence around HIV, I realize that throughout the Plymouth County, there has been 2 sets of statistics published on HIV and AIDS. The earliest, well, before the last report that came out of DPH, the one in December 2021 that covered December 2021, there were 1,259 HIV cases in the Plymouth County. Of that, there were 54% of them that were in Brockton alone. Then I reached out and I asked DPH to do a tabulation for me. So they come up with 1,295, and 711 of them are from Brockton. So which means that more than half of the cases are reported among people who claim residency in Brockton. Now,
to be clear, can I interrupt briefly, Dr. Montesser? So
yes.
Of the larger number, which is that statewide or?
No, the larger number is for the county, just for the county.
Just for Plymouth County.
For the county, and then
50% of it is of Plymouth County is coming from Brockton. How does that compare to other counties? Do we know?
I have to do a little bit more research on this, but it seems that this is a little bit of unusual because I don't know the population size of the rest of Plymouth County. But yes, we do have a population of 106,000, but to have more than half of the cases, that's a little bit concerning to me. And I'm working with DPH to see how to best to look at different ways of looking at the data and see what can be done. I know it's a chronic disease, and for those cases, there isn't a whole lot we can do because those people are already positive, but perhaps we can do some education for containment.
Well, the question also from at least to gain better understanding, are these people living with HIV/AIDS, or are they in treatment or not? Do they know? All those different questions are things that would clarify, again, we have a broad spectrum of our local and national population that have been living with AIDS now successfully, with medication and all of that. The question is, are these people that are newly diagnosed, are they under treatment or not? Do they have access to the things they need? Those are the questions that I'd like to understand. And how does that compare? You know, again, Brockton is one of the bigger cities within Plymouth County. You know, it's not unusual for cities to be different than towns and all of that. Again, so finding ways to have the context that helps us have a fuller vision of what we're looking at is important.
If I
And
may
again,
add, Mr. Chairman.
what does that mean for the larger other counties, and how does that mean for the state as compared to other states? Because again, we in general are one of the healthiest, it's not the healthiest state in the union. Is HIV/AIDS an outlier and showing something that we need to be concerned about, or is it, what is the fuller context?
Correct. It leaves a lot of questions, and I agree with you because we don't know of those cases if all of them women at the HIV level, or has any of them progressed to AIDS,
Right.
and other issues. So those are some questions that
Yeah, so that would be, something to consider for the next meeting. Again, I raised all those questions because I want to be sure our listeners don't assume things in ways that could cause alarm.
yes. Yes.
Are we talking mostly about drug use and needles?
Well, it could be
Is that-
drug use, it could be sexual transmission.
Mhm.
And
Does he have any idea what the ratio would be?
It's a combination. I don't have that with me. I have the data, but I have to look at it again. It's spread between, you have age bracket from 29 years old through 60. That's where you have the most cases represented. And then it's spread throughout male and female, as well as mode of transmission. Some of them are what's still reported as MSM, or people who have sex with men who have sex with men, heterosexual. There is a large percentage also that DPH classifies as presumed heterosexual, which means that out of this group, it seems that the only possible transmission mode is sex.
well, again, other sexual transmitted diseases are going up as well in the midst of the considerations that we're talking about. So that is a larger conversation also.
And having the contraction information will really help us and assist us in prevention.
Yeah. So again, perhaps again, we can talk about this offline and maybe have it be a agenda item that gives a more full context and some targeted talking points that allow us and those listening in to have some takeaways that allow us to understand what to be concerned about, what are the things in our control, and how can we think of prevention as well as education.
Correct. Thank you.
Any other questions before we move on?
None here.
Okay, we are on,
Probably we could talk on the state of the hospitals. I don't
Yes.
have the latest information. Last week, we were supposed to have an update from the incident command officer, but that meeting did not take place. However, we expect that meeting to happen tomorrow afternoon at 2 with DPH present. So that will give us an idea where we are with Good Samaritan Hospital. Perhaps we have a
one of
buyer.
Stuart's challenges, but we're not concerned about them closing. We're just looking for them to continue through the process of separation. And Brockton Hospital,
It is scheduled to be open sometime this month. I don't have the exact date yet, but so far that's what I have heard.
Well, that's a bright spot.
Yep.
And not on the agenda, but worth saying, we are in the midst of, it's worth, so you know, Tanika, that we had a follow-up conversation or connection with the mayor around your candidacy and some other candidacies. We're in the hopes of having a new physician as a member of the board for some of the logistical medical challenges that we need to address as a larger board, and another colleague that may be interested in joining us as well. So we hope by next meeting to have greater clarity and be to reaching out to you and be able to consider how we move forward. So we have not forgotten, and I appreciate you joining us to get a feel for how this works. And hopefully, Mr. Fisk and I will have new colleagues soon and not have to carry such a heavy load as we have for a significant amount of time.
Well, I can remember we had dark hair when we started, and now
I was going to say,
you
I
got
had
no
hair
and
and your
mine's
hair
white.
was darker. Anything else before we finish, other than a motion to adjourn?
Make a motion that we adjourn until next month.
Thank you all. Have a good evening.
You too now.
I second that motion, and have a good evening.
Have a
Good evening.
Thank you, everyone.
you.
Good night.
Good night.